Hi everyone, I'm Dr. Alvarez with Endobariatric.com and welcome to another episode of our FAQ section. And today we will talk about something that we don't get that often, but it's important to address because when patients are going through this, they're pretty much freaking out, and I want to just clear some questions for you guys. And we're going to be talking about wound care after surgery. Even though you are having this procedure done, or you had it done through laparoscopic surgery or mini laparoscopic surgery, meaning that the procedure was done through minimally invasive surgery. That means we don't open patients up. We do the surgery with very, very small incisions. And taking care of those incisions it's fairly easy. But when something arises, that is when a patient is freaking out. So normally the incisions, and the way we do it, we send patients home with absorbable sutures. That means you don't need to be worried back home of removing those stitches. Those are self-dissolvable, those disintegrate with time, and the only thing you're going home with are some steri strips, if at all, on your abdominal wall, some strips that you'll see there. Those strips fall off in about 7-10 days by themselves, regular soap and water, coming out of the shower, pat dry, and put your shirt on. That's it. It's pretty much carefree. I do tell patients not to submerge underwater like a bathtub or swimming pool for the first 15 days because that will create moisture. Moisture equals prone to infection, which we don't want. But what gets me here in front of you is what happens if we have some oozing or some liquid coming out of a certain incision, or what happens if I have a rash or something that it's a red flag, So first of all, contact your surgeon. Again, this is not as common, fairly uncommon. So if you have a doubt, a question, you can always make use of technology. I mean, you can always snap a picture of the area you have a question on. Send it over to your doctor, your doctor's office. My patients always have my direct email. Send it directly to me, and I will personally review it. And we normally get you back on track with regular over-the-counter medications, some Neosporin, or a dilution of hydrogen peroxide, water, depending on what we see on that picture. Because a picture speaks more than 1,000 words, and it does. Because when you snap a picture or pictures of that area and send it over to us, I mean, it creates a virtual consultation now, and we pretty much know what to do. So take advantage of technology. Also let you know that the first few days, it is normal to have some oozing of blood. You're not actively bleeding though, because when we do the surgery, we cut just the skin, and then after we cut the skin, we poke into your abdomen. And sometimes there's some blood vessels that ooze or bled during the procedure. And the next few days, I'm talking about maybe 1 or 2 days, once you start moving, getting out of bed, you're actually squeezing your abdominal wall, and that blood that's left underneath the layer of your skin looks for an exit and of course goes out. Patients see it, they're thinking they're bleeding to death. All right, that's expected, it's normal, it's quite frequent, but it's very important to distinguish this type of oozing the first a day or two, than oozing 5 to 7 days out, which is very, very different. So if it's happening 7 to 10 days out, contact your doctor's office and snap a picture, show them your rash, or show them the affected area, show them the oozing or that precise incision, and I'm sure they will get you back on track. All right? So I hope you find this information useful. If it was, leave me one of these. Thank you so much for supporting the channel. And of course, if you want to hang out again with me, be sure to hit that subscribe button. All right? I'm Dr. Alvarez with Endobariatric.com, where we are Changing lives one sleeve at a time. Take care and God bless.